Good day, everyone, and welcome to my presentation or my final oral presentation on my research topic, awareness, knowledge, and attitudes towards patient confidentiality among healthcare workers in Grenada. My name is Simone Pierre, and my faculty advisor was Mr. Jared Sincere. I would be discussing the introduction, methods, results, and conclusions of the research that I did. So let us begin. Let us start off with the introduction. So, in Grenada, medical records are often stored in rooms and computers. The thing is, in Grenada, we have not fully gone with the electronic medical recording system. So we would have to resort, especially in places like our clinics and our health stations that are out in the community, we have to resort to storing it in rooms and computers. And in many of these cases, the rooms and computers are unlocked and the computers are unprotected. With that, there comes the potential for breaches in security of the medical records of the patient, or breaches in the patient confidentiality, or the ability of medical professionals to keep the patient's records safe, right? The definition of patient confidentiality is the ethical and legal obligation to protect the patient's health information from unauthorized access, disclosure, or misuse. So if you have situations where the rooms are unlocked and the computers are unprotected, that leaves the ability for example, many persons within that health clinic, for example, having access to the medical records. That includes doctors, nurses, dentists, pharmacists, even persons outside the scope of the patient care, for example, sanitation workers, administration, even patients themselves sometimes can access rooms and so, right? Breaches in patient confidentiality or a patient feeling that their medical records are confidential or secure can reduce or decrease the patient's trust in the healthcare system, right? And of course, you can realize or recognize that this will adversely affect the patient's health, right, outcome in many ways. If a patient believes that they cannot trust that their sensitive information is secure, how can they be open to say, I can trust my healthcare provider, I can trust the health worker with my information to begin with, right? That may cause patients to be reserved and not give all of the information when, for example, the doctors or their nurses also ask them a question. Yeah, that can have many consequences leading on. That can cause the healthcare workers to misdiagnose or underdiagnose or overdiagnose the patient. That can cause the patient to delay or avoid treatment because of these misdiagnoses. That can also cause the patient to maybe even be non-compliant with what their healthcare worker or healthcare provider is telling them to do. Limited research on all ethical, bioethical practices and principles are limited within Grenada and the Eastern Caribbean, especially on principles of patient confidentiality. This is the reason why I was so thrilled or so eager to do this particular topic, because I believe we need to figure out what are the gaps. First of all, are patients aware, right? Do patients have the knowledge? And what are the beliefs that healthcare professionals have towards patient confidentiality in Grenada? Right? These findings will hopefully help to update policies and laws to improve compliance with confidentiality policies and hopefully impact positively patient healthcare and patient outcomes. So what are the methods that we used? So it was an observational cross-sectional study using a 21 question knowledge, attitude, and practice survey. There are 658 health workers in Grenada. So we used that as our population, and that was based on Powell's report from 2017. We got IRB approval, CMO permission was granted, and we pre-tested that survey with 10 medical professionals. The surveys were distributed both physically and virtually, and that was done to try to reach as many persons as possible at their convenience. And we tried to reduce that selection bias by distributing it across many, we should say, diverse facilities. So we tried to get to the hospitals, to the clinics, whether public or privately owned, pharmacies, dental clinics, right? So as much so that we can try to get as many healthcare workers as possible. And we had clear instructions on both printed and digital formats to reduce information bias. And also, persons had the ability to call into the investigator to get any additional questions that they had um, answered. We analyzed the data using RStudio with descriptive statistics and a Pearson chi-squared test, and that is what we're going to be discussing in the next, after this upcoming slide. So as it relates to our response rate, as mentioned before, the population was 658 healthcare workers, and we calculated a sample size of about 243, and we had 110 completed surveys, so that gave us a response rate of 45%. The um, results, right, from our methods, so how we gathered our data. Out of the 110 surveys that were completed, the most populous or group there was physicians at around 42 persons or 38.2%. Then it went to nurses, which were about 34 individuals and about 31%. And then it was CNAs after with about 20%. And then we had contributions from dietitians, dental assistants, orderlies, pharmacists, etc. So what we would have seen in the survey is that about 32.7% of the participants had less than 5 years experience in their role, right? So that's significant. So large percentage or less than 5 years experience. What was a good thing though in terms of the awareness questions was that 95% of the healthcare workers were aware of the term patient confidentiality. And they were aware through things like, school or on-the-job training. However, what we noticed is that even though they were aware, only 43%, or 43% rather, incorrectly believed that patient confidentiality and patient privacy were the same. So they were not able to distinguish. When we moved on to the knowledge questions, we had some good responses with some questions. For example, questions on consent. So a question like, is patient consent necessary to release patient information to third parties? Can patient access their health records, right? These had very good, statistics, right? Above 85% were able to answer the questions correctly. Conversely, though, there were some knowledge questions that had about 50-50. It was very, one side versus the other. And for example, questions like, is patient confidentiality governed by law? Healthcare workers were not able to answer that question correctly. Also, do patients have a right to withhold medical information? Healthcare workers were also not able to answer that. There was a 50-50 on that. So just leading back to that very first point or first 2 points where we had a 95, almost 100% awareness of the term, but then they couldn't answer whether these two terms were the same. What we did was try to figure out if there was a correlation between whether the number of sources of awareness affected whether they can distinguish between patient confidentiality versus patient privacy. And we noticed that there is a significant correlation, and likely that persons with an increased number of sources of awareness were able to correctly differentiate between patient confidentiality versus patient privacy. So what are some of the conclusions of our research? One, participants demonstrated a solid foundation of or awareness and understanding, right? Especially when it comes to consent requirements and access restrictions. However, we noticed, of course, that there were some significant knowledge gaps, especially in the legal aspects and the family access rights, right? So what would we need to do? We need to do research. We need to do further research in order for us to identify these gaps in the current knowledge and guide policy improvements. And with those policy changes, hopefully we can improve training, right? That can hopefully enhance the patient's trust and strengthen confidentiality practices in Grenada and by hopefully extension the Eastern Caribbean. So that is the end of my presentation. Thank you so much for your attention. This is my bibliography with my references for any additional perusal. Thank you again for your attention.